Today on the Cruz Orthodontics podcast, we're going to talk to Dr. Cruz and go over all the questions you should ask when you're looking for an orthodontist to make sure you choose the best orthodontist for you and your family. One of the first questions we advise everyone to ask when they're looking for someone to help their child or them straighten their teeth is ask the practice if they have an orthodontist or a general dentist on staff and what is the difference.
Starting with education, the primary difference is that all orthodontists are general dentists, but then they spend an extra, oftentimes 2 to 3 years in residency, specializing in learning exactly how to do orthodontics and focusing on that solely, as opposed to oftentimes what general dentists will do is they oftentimes have to be a jack of all trades. So they know how to do fillings or implants or root canals, etc. Where we as orthodontists have been trained to specialize just in the field of orthodontics. And then that also carries over into the way that you design a practice. So the staff that you bring in, the way that you lay out the office. And so the flow for being able to treat patients orthodontically is oftentimes quite different in an orthodontist's office versus a general dentist's office. And so from head to toe, the way that we set things up is quite a bit different. And then when you look at the staff that we have, our orthodontic assistants, our treatment coordinators, our financial coordinators are geared specifically to orthodontics. So if you have issues, we know how to resolve those issues because it's all we do. And so it's not to say that there aren't general dentists out there that are very competent in doing orthodontics, but what I would keep in mind is that it's all that we do. And so we sort of pride ourselves in being very good at it.
Okay, so that leads into the next question. What are you, full-time orthodontist or part-time? How does that work?
Good, yeah, okay. What I would say to that is what's starting to become more and more popular is that a lot of dental offices are becoming owned by corporations. And so you saw this happen in the medical field decades ago, and you're starting to see it creep into other industries. And as that pertains to whether you're full-time or part-time, oftentimes a lot of these corporate offices will be multi-specialty offices. So they will have general dentists, they'll have an oral surgeon, an orthodontist, etc. But oftentimes these specialists are only in a day a week, and that's not necessarily known to the patients. And so you're pleased with the treatment plan, you decide to go through with treatment for yourself or for your child, and then you're now committed only to find out that it has to be Wednesday afternoons, for example. And so it gets really challenging for a lot of these families that have busy schedules. And so for somebody like us, we're open 5 days a week and we are available to schedule appointments, much more flexible. And so that has become kind of a big deal, at least in the community that I'm in. And I think the frustration for me kind of stems from the fact that it's not necessarily made apparent to a lot of these families until sort of after the fact. They go to start scheduling and they realize, wow, what's going on? Why can't I schedule on these other days?
Yeah, so that really leads to another question we have is, do you have flexible hours for, say, after school, etc., for busy parents?
Absolutely, yeah. And so we make sure that we actually have 1 day a week where you have the opportunity to come in before school. I know oftentimes a lot of the kids aren't particularly thrilled at that. They'll come in rolling in at 7 a.m. to come see us on Thursday mornings typically. And then we also have appointments available for after school as well. And so going back to your point about, what is the difference between an orthodontist and a general dentist, we understand our patient demographic. And so we want to make sure that we create a schedule accordingly. Everything we do is to make sure that we're providing the best service in this field of orthodontics.
Another question is, how many years have you practiced only orthodontics?
This will be 20 years. So next month it will be 20 years. And so I was telling somebody the other day, it's starting to get kind of interesting because I'm starting to treat, my patients' kids are now old enough to be ready for orthodontic treatment. And so yeah, I've got 20 years under my belt. I graduated from residency back in 2005.
So if a parent is interviewing a practice, how important is it that orthodontist has this experience? I wouldn't think, for instance, if I was going to a doctor, how long have you been a doctor? But that's a really interesting question. Do a lot of practices have orthodontists that have just been practicing for a few years, for instance? And does it really matter?
Yes, some good stuff to unpack there, because the way that things used to work is that, oftentimes you would graduate from residency and you would be able to work as an associate for a private practice and work under an orthodontist that had decades of experience. And as good as residency is for those 2 or 3 years, there's no substitution for being able to learn from somebody that's spent their life, really mastering this craft. And so what's starting to happen quite a bit more, especially with these corporate offices, or oftentimes pediatric dentists will hire an orthodontist, is they're hiring recent grads. And I was a recent grad, and so this isn't to say that young orthodontists are not capable. That's not it at all. But what it is to say is that there's so much value in being able to have a senior orthodontist take you under their wing and really show you the intricacies of this specialty. It takes a long time. The thing that you have to understand is, unlike a lot of treatment in medical and dental, where treatment might take a day or a week, in orthodontics, it can take 1.5 to 2 years. And so when you think about how long it takes in your career to treat multiple cycles of patients and really learn from those long cycles, it takes time. And so if you're doing it alone, to where you're working in an office like these corporate offices where you don't have a mentor, it's incredibly challenging. And so part of me is actually really sympathetic for these young orthodontists, because they don't have the guidance that I think that they deserve. In my particular case, yes, I will be forever grateful for Dr. DeAlba. He is who I bought the practice from, and he was a master at being able to provide really excellent results. And so I try and think to myself, gosh, if I didn't have that, where would I be? I don't know. Yeah, I'm forever grateful.
What about treatment? Do you handle all the treatment? Who does the adjustments? How does that work from practice to practice? What's the best way to do that, in your opinion?
Orthodontics is a bit unique. Sometimes other specialties will sort of tease orthodontists because they say, oh, you don't do any of the adjustments anyway. And to be fair, there is some truth in that. We have amazing orthodontic assistants with tremendously great hands, and this is primarily what they do. And so it's definitely teamwork without a doubt. Legally speaking, there are things that an orthodontist can do only and that the assistant can't do. And so when you think about the teamwork that's involved, a lot of the kind of day-to-day routine adjustments are definitely done by the assistant. But what's really important to understand is that it is the orthodontist that sits down and decides exactly what needs to be done prior to it being carried out. And so, here in our office, with the use of dental monitoring now, what I'm able to do is actually look at our patients' scans, at their bite, at their teeth prior to them coming into the office, and prepare for that appointment so that the assistant knows exactly what to do. And so there's definitely a melding of working with the assistant and the orthodontist. I'm ignorant because I don't know other specialties, but I assume that that's probably pretty similar in the medical field with nurses and doctors. I'm sort of guessing.
All right, the next question we suggest is, do you have training in advanced early ortho and bite correction?
We do. That was all part of residency. And so it's actually a good point, because a lot of time that you spend in residency is actually studying these very famous growth studies and understanding growth of jaws, the difference between how the upper jaw grows versus the lower jaw, dental development and eruption. And we take a deep dive into all of that. And it's not to say that you don't scratch the surface in dental school about that, but we definitely go into much more detail. We also spend lots of time in being able to figure out how you can correct jaw relationships at a young age. So oftentimes there are certain populations that will have underbites, and there are things that you can do at a young age to be able to resolve that or expand the jaws, etc. So yes, the short answer is yes, absolutely. And that is a really kind of critical part in orthodontics, to make sure that as the child gets older, you avoid these other major potential issues like needing jaw surgery or needing extractions of teeth. So yeah, that's a critical part of orthodontics.
The next question we suggest is asking the practice, what is your diagnosis and why? Why do you think that's an important question to ask?
So the first thing I'll say to that is, oftentimes patients will come to see me because they want a beautiful smile. They want straight teeth. And so there's so much more to that that you can then educate the patient on. And so the function of the bite, making sure that the bite is not traumatic and teeth are going to chip and wear over time. The jaw joint is going to be, remain healthy. You hear lots of people that have TMJ issues. And so the diagnosis is actually critical. I can only speak to our office, but we take x-rays, we take photos prior to the examination. I sit down, I do a thorough examination, and then I sit in front of the computer many minutes discussing what the findings are and why that's important. And so oftentimes patients will go, wow, that was great, I really appreciate that. I just thought, straighten the teeth out. And it's like, no, there's quite a bit more to it than that. And yes, we do straighten the teeth out, of course, but I want you to understand what goes into this. And so that can be really helpful for a lot of our new patients.
Another question is, should we start now or should we wait for more tooth development to happen?
It's actually a small percentage of patients that need phase 1 therapy, in my opinion. So you'll hear this phrase of 2 phases of treatment. And so I'll oftentimes explain to a lot of families that will come in as a second or a third opinion saying, we were at another office, they said that my child needs expanders or whatever the device is. And in my opinion, oftentimes that's not justified. And so it's really important to make sure that if you are going to do an early phase of treatment, that it's justified. And so there are usually just a few reasons as to why you think about doing orthodontic treatment for an 8-year-old or a 9-year-old. Extreme crowding, extreme spacing, underbites, crossbites. There's only about 4 or 5 things that you'd really look at and say, okay, this is justified, because if we don't resolve this now, it's going to escalate into a bigger problem later. Unfortunately, what I think some offices do is that they think if I can get this patient to commit to a phase 1, I can sort of lock them down, and now they're not going to go to other offices as that patient gets older. And it also increases the likelihood that they're going to do the second phase with our office as well.
Oh, that's kind of sad to hear, because that's totally a marketing sales ploy. That's not really the benefit of the patient, right?
It really upsets me on a number of levels. I'm really proud of our profession. I think we as orthodontists provide an amazing service. We help with obviously the bite and the smile and self-confidence. And so I'm really proud of our profession. So it becomes frustrating when you see people that potentially degrade the great things that we're doing. And so, I think you see it in every industry. People are chasing that almighty dollar, and sometimes it's not in the best interest to do that.
So would you say in general, if someone recommends phase 1, that you get a couple more opinions just because that's possible in the industry?
My answer would be that if there's not a really detailed, logical explanation to back it up, get a second opinion. Because it really doesn't take much time and explanation to explain why you need this. This is not rocket science by any means. And so when you have a panoramic x-ray and you have detailed photos, it's very easy to show what an underbite looks like or what a crossbite looks like. And it's easy to follow it up with, if we leave that and we don't resolve it now, these are the repercussions. But I think a lot of offices don't take the time to do that. And they sit down, they look at the child, they say, yep, your child needs a phase 1. This is what we'd recommend. Let me know if you have any questions. And then they're kind of out the door, and they'll leave you with the treatment coordinator or the financial coordinator. And so literally just 4 or 5 extra minutes of saying, let me explain to you why this is important to resolve now goes a long way. If you don't get that, definitely go see somebody else.
All right. So another question is, what options other than Invisalign do you provide? Do you think this is an important question to ask? Does it matter if someone doesn't offer anything else other than Invisalign?
Yes. In fact, I would be leery of an office that only does braces or only does aligner therapy. I would be cautious if they are just sort of, for lack of a better term, kind of a one-trick pony. And the reason I say that is that Invisalign is fabulous for certain types of bites that are difficult to resolve with braces, and braces can be fabulous for certain types of bites that are really challenging to resolve with Invisalign. And so it's definitely a fair question to ask, hey, what type of therapies do you offer? And in addition to that, when it comes to what you do, it's probably worth also asking, what type of braces do you use? And the reason I say that is that there are what we call standard twin brackets, and they've been around for many, many decades, but there are much better braces out there available, and a lot of offices don't use them. One, because they're more expensive, even though they are much better for the patient on a number of reasons. They're more comfortable, they're easier to clean, it's more efficient to move the teeth. But you can get these twin brackets that are old for a fraction of the price, and oftentimes patients don't understand the differences between the two. So not only would I ask, do you do aligner therapy and do you do braces, but if so, what type of braces?
All right, another question we would suggest you ask is, why is this the best option for my child? What should someone expect as an answer to this question?
In the field of orthodontics, oftentimes there are many, many ways to come to the same results. So, it's really worth talking about this for a minute, because I could come up with a treatment plan that sounds drastically different to another orthodontist that has, a very different plan. And ultimately, both of those plans are correct. So it can get a little bit confusing. And sometimes I'll sort of sympathize, and I'll even apologize to some of our new patients that are coming in for a third or a fourth opinion, because I can sort of see that their head is spinning to the, I don't know who to believe now. All of these plans are so drastically different. And so I'll then take the time to explain why these other plans are still perfectly acceptable, but why I would recommend doing it the way that I'm recommending it, and then give reasons, whether it's for efficiency, whether it's for patient comfort, whether it's for compliance issues. There are all these other things that you have to factor in. And a good example of that is, do you pull teeth or not? And so, it used to be very common to have teeth extracted. And yes, it absolutely resolves the issue of crowding, and you can definitely get a good result. But oftentimes not extracting has all these other potential benefits. And so taking the time to explain that is really helpful. And I think it puts the parent and the patient's mind at ease of, okay, this person is actually considering all of these options and then making sure that they're picking the best one for me personally. And so it shows that I have a fairly deep knowledge of all of these other options. It's not like, oh, I've never heard of that before, this is the way we do it. It's more, yep, I understand that. There will actually be times where I say, don't tell me what the other offices have recommended, and let me explain to you what I would recommend, and let me guess as to what I think they're recommending. And they're like, how did you know that? And so, I just want them to understand that it's not because I only do things one way. I'm just trying to explain to you that this is why I think it's the best way.